name is Dr. Spencer Payne, and I'm an otolaryngologist, often more commonly known as an ear, nose, and throat surgeon. I specialize in the treatment of nasal and sinus disorders at the University of Virginia, but wanted to talk to you about COVID-19 testing on behalf of the American Academy of Otolaryngology, Head and Neck Surgery, for whom I presently serve as the chair of the Board of Governors. Current data indicates that somewhere between 15 and 20% of COVID tests will be negative, meaning they won't detect the disease even when the patient really does have the virus. As a result, it's important that we all know the best way to perform the swab testing in order to optimize our ability to detect the SARS-CoV-2 virus. Just a very superficial perusal of the internet will find videos attempting to teach testing via nasopharyngeal swabs where the swabs are aimed in the wrong direction. This includes videos by news outlets, organizations who represent clinical laboratories, and even a manufacturer of one of the testing kits. So how should we be doing testing for COVID? The CDC recommends several options as being acceptable. This includes nasopharyngeal swabs, oropharyngeal swabs, a nasal mid-turbinate swab, an anterior nares or nasal swab, or a nasal or nasopharyngeal wash and aspiration. Some studies have indicated that the oropharyngeal swab and the nasal swabs are not as good as the nasopharyngeal or mid-turbinate swab, so let's talk about both of these instead. At present, the nasopharyngeal swab is probably considered more of the gold standard test. Let's look at this model here. We can see that inside the nose are 3 bumps, which are called turbinates. The job of the turbinates is to add heat and moisture to the air we breathe, and usually it's the turbinates that swell up when we have a cold, causing nasal congestion. The path to the nasopharynx is below these turbinates, along the floor of the nose, going all the way back to the nasopharynx, where there is usually a significant amount of mucus or secretions during a viral infection. As you can see, this path is much closer to a line from the nostril to the ear canal, which is more down than the upward path often shown in several online videos. There is also a nasal mid-turbinate swab. Some studies indicate that this may be as good as a nasopharyngeal swab, but may be even more easily done incorrectly. The CD indicates that this test may be preferred since it is better tolerated and can be done by the patient, which reduces practitioner exposure. But since the turbinates are quite sensitive to touch and pressure, I'm not sure this is really an accurate statement. The concept of this technique is that the swab is aimed about 30 degrees from that same line between the nostril and the ear canal and directed to the area between the turbinates, right here. Only about 1 to 2 inches into the nose, as opposed to the 5 or so inches it takes to get to the back of the nasopharynx. I hope this information has been helpful, and on behalf of the AAO, HNS, and its foundation, I want to encourage everyone to continue to exercise social distancing and mask wearing to help minimize the spread of this global pandemic. Thank you so much for watching.